Hello and welcome to Reopening Hamilton County Schools, a video program where we try to share information about how we're going to reopen schools, what it may look like, and choices for parents. In this segment, we're talking with Dr. Charles Woods, a specialist in infectious disease with Erlanger, a part of the task force looking at reopening Hamilton County schools in the fall. And Dr. Woods, just starting out, thanks for your work on the task force, and I know you also have help present to the board members and are sharing your expertise in this process. Just talk with us a little bit about, from the health perspective, how you guys worked with the task force to put together the plan for entering school again, and how the doctors were involved in that.
So first, I think there was a lot of really excellent work done by the Hamilton County School Board system staff and leaders in reviewing national recommendations and from a number of different bodies as to how to try to reopen as safely as possible, because I think the goal for everyone is to have children in school as much as possible, but we want to have them safe and have our teachers and other staff safe. So I think they've put together a very well thought through plan. And as healthcare professionals, Dr. Adams and I reviewed a lot of that with them, but basically really served largely to say, we think you're doing the right things based on the things we're reading, the things in our experience that has been put together effectively. You know, I will say also, it's iterative. It's not boxing the school system into only one approach going forward. It allows flexibility as we learn more in the process to make adjustments if we need to, either to stay in school under conditions that we might have thought we wouldn't be able to, and possibly to ratchet down more quickly depending on the circumstance than the initial plan might have called for. Again, as we learn more and more, every week we know more about this virus and how it's affecting our various populations. So we will have to adjust as we get new information, and I think everyone is open to that. I think that's an excellent approach.
And I know everyone's wanting to know exactly how it's going to look and what we're going to do right now, but it is kind of a fluid situation as we continue to look at the health situation of the community, because that's really what determines how we open and what phase we're in. It's all about spreading in the community, what our community does to prevent spread and keeping everybody healthy, right?
Well, you know, what we're seeing now in the county is we certainly have the highest numbers of adults hospitalized in the three main hospital, or the hospitals in Hamilton County, all three systems combined, that we've seen to date. Now, there's still a lot of capacity. You know, we're not overrun like is happening in a good number of other states right now. So we believe we are in reasonable shape overall. But it's that number of hospitalized adults is essentially like the tip of an iceberg that sort of shows us the larger, the rest of the iceberg is sort of the rest of the infection in the community. So as the tip of that iceberg grows, it tells us that there's more infection out there. Plus, we have the results of just general testing of people who are either sick or getting tested asymptomatically for various reasons. But those may undercount in the infection rate, or may not always give us the true picture. So we'll look at all of these numbers together. I guess I should say we wouldn't look at anything in isolation, but we look at that number of adults in the hospital in addition to the new cases per week. And we can calculate how many new cases we're seeing that are confirmed per 100,000 population is the way we kind of look at those numbers. And if we see that rate going up, and in addition, we see an increase in the number of adults hospitalized, that gives us a sense that there is more infection in the community than there was. If we see the rate going up and we know we're doing a lot more testing, but we're not seeing our adult numbers go up, that just may mean we're seeing the results of doing more testing. But right now, we know in Hamilton County, we're seeing an increase in the adults hospitalized, which means we're having some increase in the amount of infection that's in the community. And it's not, the increased number of positive tests is not just due to testing, more testing alone. So we are having some increase, but it's not as rapid, at least yet, as in some other areas of the country.
As we do look at the beginning of school and students coming back, I know it's kind of the same as if you're out in the community, how you protect yourself, but face coverings are important, and give us kind of the to-dos to keep yourself and your children healthy in the community and at school, and things they can be working on now to prepare kids for the fall.
Well, one thing, certainly, wearing masks is not 100% effective, but it has significant protective effect. And it protects in two ways. One, it can protect you from getting infection from someone else who may not know they have it, or it may protect someone else from getting infected from you when you may not know you have it. So it's a way of being a good neighbor right now. Now, masks are often annoying. I don't like wearing them, but that's something I'm going to do in public myself because I believe it's the right thing for us to do right now. Certainly as parents, if we model things for our children, that, number one, helps them see it perhaps as normal. And I see little children in the hospital all the time wearing masks, at least happily for the moment. That doesn't mean every moment of it's going to be happy. I wouldn't say that. But young children can wear masks. And so we don't recommend them under age 2, but 3, 4, 5-year-olds can wear them for periods of time. And certainly out in public, that is probably a useful thing, may protect them from getting infected. One of the things that is talked about a lot is, number one, children typically have milder infections on average than teenagers, than young adults, than older adults. So there is an increasing likelihood of severity of infection and hospitalization the older we get and if we have certain underlying diseases. So most of the children, truly, if they get infected, are going to have relatively minor infections, not much different from a common cold, and many may be asymptomatic. But there will be a small percentage, it might not even be 1%, but it's going to be some percentage that will end up in the hospital and sometimes in the ICU, and sometimes there'll be a complication. And we know we've had a number of deaths of children around the country due to this virus so far. And, we don't want to lose any child to any condition. And while it's rare, it's not zero. And people need to be aware of that. We want to have that, we don't want to sacrifice anyone if we don't have to. So wearing a mask and having children wear masks within reason as much as possible can help with that. And so that's why we believe that is a good thing to do. I know there's questions about it, but I think there's evidence that wearing masks does protect from viruses like this. There are other human coronaviruses and other viruses that are spread similarly, and masks do really help with those. And certainly in our healthcare settings, when our healthcare professionals are wearing the masks, often N95s and not surgical, but even the surgical masks in a lot of settings, we're not seeing them get infected from exposures that are happening. There are some cases where we see transmission, but most of the times we see healthcare workers infected, it's when they've not had on protective gear in the vicinity of an infected patient. So we know that, we have a lot of lines of evidence that suggest that masks really can reduce our personal risk and our risk of transmitting to others.
All right, Dr. Woods, we appreciate you sharing some medical information with us today on our video for the week, and I'm sure we'll be talking with you more throughout the month as we get ready to move into August and looking toward the reopening of schools in the fall. We appreciate your work on the task force, and thanks for the information today.
Thank you so much.
And that's it for our program for today. Thank you for joining us. I'm Tim Hensley, Communications Officer for Hamilton County Schools.